Okay, first thing I'm going to do is check my patient's chart, make sure I need to know what I need to do. Who my patient is, I need to do a trach suctioning and a trach care. So the first thing is gather my supplies, making sure I'm checking all of my supplies, make sure the integrity is good and the dates. Next thing I'm going to do is I'm going to go knock on the door. Hello, get entry, and once I'm in, I'm going to introduce myself as a student nurse at MATC, perform hand hygiene. After that, I'm going to identify my patient with 2 markers, usually a wristband. You are so-and-so, and can you state your date of birth? Okay, done. And then I'm going to explain them what I'd like to do. Today I'd like to do a trach care and suctioning on you. Are you okay with that? How is your pain on a scale of 0 to 10? Can you rate your pain being 10 just being very terrible and excruciating, 0 being your no pain at all? Say that they're good to go. I'm then going to provide for some privacy. Okay. I've gathered my supplies right here. I'm then going to set up my station. Raise this to my waist height. Raise the bed. And then she is conscious and alert and oriented, so then I'm going to raise her in a semi-father's position. Okay. All set up, I got my trash and I got all my stuff. And then I would like to assess your respiratory system. Then go ahead and assess the respiratory system. And then I'll do that at the end of care as well, which I will do myself. So to get started, first I would put on some clean gloves. Turn on my pressure to regular. And then set it to the appropriate amount for an adult, which is 100 to 120. And it's at 110. I'm going to put that in its nice secure spot. Okay. Off those gloves. Perform hand hygiene. Okay. Lower my rail so it's easier to work with my patient. I'm then going to set up my field to work with. This is my suctioning kit, my sterile gloves. Okay. Going to put a little bib like that. Make sure my patient doesn't get dirty. And then I need to suit up. So I'm going to get my gown out. Okay. Stretch. Okay. Okay, face mask is next. Okay, then I'm going to get my kit ready for suctioning. I'm going to open the kit away from me, opening up the contents. Okay, and then I'm going to get ready my saline, not touching the inside. Check my saline, it's good. Palm it. Dip it. Pour some into my container. Then need to put on some sterile gloves. Okay. Sterile gloves are on. Now I need to get my suctioning kit. This will be my sterile hand. This will be my clean hand. Then attach it. Okay, I got that. Now if you can assist me, would you like to hyperventilate the patient? Okay, gonna do it. Probably working, and I lubricated it. And very carefully, I'm gonna center it right in the middle, pushing it down, and then I will to twist and intermittently suck. Done. Could you hyperventilate? Clean the catheter. Okay, one more lubrication. Okay, just one more time. We're going to wait 1 minute before I do the next one. Can you apply the oxygen? Okay, we have waited 1 minute until the next interval. So then can you hyperventilate once more? I'm going to insert once more. Down, and then I'm going to twist and intermittently. Done. Hyperventilate. I'm going to clean the catheter. Get it nice and clean because I need to clean her mouth. Can you assist me? You open up. Just going to go inside. Do a little on the side. Go on the other side. Suction. Okay. Good. Then administer oxygen. Okay. I'm then going to wrap this up and get that out. And then I need to remove the inner gauze underneath the stoma. So then I'm going to carefully, can you tilt your head back for me, please? Okay. I'm going to carefully kind of sneak this out underneath. Okay. Now that I've got it, I'm going to put it all inside my glove. I'm going to pinch my glove. Careful not to touch anything. Get it all in there. Okay. And discard. Perform hand hygiene. Okay. Then going to discard this from my area. And I don't need this. Next, I need to put on sterile gloves once more. I need to remove the inner cannula first before I put on sterile gloves to put on the clean one. I'm going to assess breathing sounds after. Okay, so now I need to remove that. I will hold the base, twist, and carefully pull out. I will then discard this, but I need to save this for the next time. So discard it. I will then take off my gloves, perform hand hygiene. And then I need to open up my sterile gloves and get ready for my Trach Care suctioning kit as well. I'll open up my inner cannula, sterile, okay, and my Trach Care kit. I then need to get my saline, zip it once more. then need to put on my second set of sterile gloves. Come on. There we go. Now that I have my sterile gloves, I need to find my cotton swabs at the bottom of this. I'm going to get those ready. And then I will take my inner cannula out of my sterile package and carefully, not touching anything else, hold the base plate and insert the inner cannula back into the patient. That is good. Put the oxygen back on. Now I need to clean the stoma. Now that my supply is set up, I'm going to take my cotton swab, dip it, and then I will go underneath the stoma, cleaning from the center outward. One wipe and discard. Gonna dip and clean the other side from the inner stoma outward. Done. And discard. I then need my gauze. We'll get my gauze, and I need to dry it underneath the stoma. Inward, outward, one wipe, and discard. Let's do the other side. Need to wipe and discard. Okay? And then I need to replace the inner lining with this one. So I'm just release. I will slide it underneath the patient. Can you tilt your head back for me, please? Thank you. I'm going to slide this underneath and on the other side so it is snug and flat. Okay. Just a little bit. There we go. Okay. Then I would need the help of my assistant to do the ties, which are also in the kit. Just assist me. I'm gonna hold the faceplate down, please. This will only take a second. Sorry. I'm gonna do the opposite side first. Being careful. Okay. Once that's through, do that. Okay. Excuse me, tilt your head up for me, please. Thank you. Just gonna slide these ribbons around. Okay, you can lean back down. Thank you. Still holding the stoma plate. Release the other side. And slide out that. We'll then tie it snug, but not too snug. And I would like to put one finger underneath in between the neck and the tie. So I know it's snug, but not too snug, and so that the patient can move their neck so it's not inhibiting them. Tie that. There you go, and I'll cut the rest if necessary. And then we can apply the oxygen back. There you go. Oxygen back. We'll then clean up. and discard. I will then take off my PPE, take off one glove, take this, like so. Take off the other glove, untie, and roll this up to a little ball and discard. I'll then remove my mask, discard, perform hand hygiene. I'll then offer her oral care in case she wants it. And then I would like to assess her respiratory system. So this is where, if she's willing, I would then say, I would like to assess your respiratory system. I need to take you a few deep breaths, so I'm going to provide for comfort and privacy. Then lift her up a little bit. Notice for any tenderness, any lesions, do a quick assessment. Make sure it's okay, and then we'll listen for sounds. Now, we'll listen for a breath for each positioning of that. So in and exhale. Up at the apex, inhale and exhale. We'll go underneath, inhale and exhale. Other side, inhale and exhale. Providing for comfort and privacy, inhale and exhale. Other side, inhale, exhale. Inhale, exhale. Good. Inhale, exhale. On the side, inhale, exhale. One more. Good. Well, that's the front. I'm just going to need to set you up so we can assess the back. Okay, just lean up for me. Thank you, assistant. And then starting at the apex, once again, inhale and exhale. Okay, inhale and exhale. Listening for vesicular and bronchovesicular sounds right along the spinal cord in between the scapula. Inhale and exhale. Inhale, exhale. A few more will be done. Let me know if we need to stop in case you cannot breathe or you feel faint. Squeeze my hand. Okay, we'll continue. Inhale, exhale. Okay, inhale, exhale. Last one, inhale, exhale. Okay, good. Seems like the trach suctioning was successful. She's able to breathe better. I will then make her comfortable. Get her call light available. There you go, in case you need it. And then can you raise the side rail? Then raise the side rail, turn off my system. And then I will clean up my supplies, perform hand hygiene one last time. And then I will need to lower the bed, because that's how I found her. And then, is this a comfortable position? Would you like to be left at semi-folders? She complies, says yes. So, we're at the possible position. And that is my trach care video. Thank you.